Partial knee replacement should be thought of in a similar way to total knee replacement, in that the threshold for deciding when to move forwards with surgery should be pretty much the same. It does vary between patients, but because knee replacement surgery is classed as major surgery, even though we do it very commonly, the symptoms have to be quite significant. They have to affect nearly every part of your daily life. It's usually pain, stiffness, and reduction in function that most patients are complaining about. And so we would expect you to have already reached a point where your knee is stopping you doing the things in your daily life that you routinely enjoy. That's walking to the shops, walking for recreation. A lot of patients complain of pain at night that disturbs their sleep. If those symptoms are becoming very prominent, then that is the time when one should consider seeking advice about the usefulness of surgery. One does presume, though, that patients have tried everything else first, so it is sensible to make sure that working with your general practitioner, that you've optimized your pain management, you've tried to get yourself in as good a shape as possible, and sometimes patients try injections, and if all of these are failing, it seems that that's about the right time to move forwards with joint replacement. Yeah, partial knee replacements are a major operation, but it is a very common operation. About 8% of knee replacements going in the UK every year are partial knee replacements, and there's room for increasing that. It requires some form of anaesthetic, and my anaesthetic team will work with my patients to work out with them an individualized plan. So the patient doesn't feel anything at all whilst we're doing the surgery. Some patients like to be awake and hear things. The procedure involves removing the arthritic bone, shaving and cutting away the worn surfaces, and then replacing them with metal and plastic parts. The procedure commonly takes somewhere between 45 minutes and an hour and a half, depending on the patient. And there's lots of preparation that can be done before surgery, like a knee replacement. It's best to try and get yourself in as good a shape as possible. And that usually means engaging in some of the exercises that you would be instructed to do after the surgery, to engage in them beforehand, to get the muscles around the knee as strong as possible. I think this serves two purposes. One is getting the muscle function better, but the second is training you and showing you how to do the exercises that you'll need to speed up your recovery and get you the best result after your operation. So that's certainly one thing. Optimizing all of the other medical conditions that you might also have. And then not forgetting that recovery from knee replacement back to being fully functional takes a number of weeks. So preparing the home, preparing your support circle around you is also very useful. Removing trip hazards, making sure that your home or home environment is suitable to allow you to recover as quickly as possible. Well, these days there have been a lot of advances in pain control, and we do focus on that in the early post-op period. And I find that my patients who can get on top of the initial discomfort after surgery do better because they're better able to engage in the physiotherapy and exercises that are required. It's really important to get the knee moving as soon as possible. Depending on the anesthetic you've had, that can be straight away. The faster you get moving, usually the faster your overall recovery is. A lot of patients do benefit from cooling the knee joint in the early period after surgery, and there are various devices that can be acquired to do that, over and above the packet of frozen peas that a lot of patients use from the freezer. But cooling is certainly very important, and maintaining a good level of analgesia, painkillers is also very important as well. It is it's necessary to get a good relationship with your physiotherapist and working with them to perform the exercises to get the knee moving and get you the best function that you can out of your knee after we've done the surgery. Yeah, there are quite a few studies that show that partial knee replacement patients tend to have faster recovery and higher levels of function, certainly in the early period, than patients undergoing total knee replacement. Unfortunately, not everyone is suitable for partial knee replacement, but those that do have a successful partial knee replacement do get those benefits. We also know that the complication rates with partial knee replacement are lower than that for total knee replacement. So for the right patient, a partial knee replacement is often an operation that helps them get back to the activities they want to do faster.